Your another important topic. This is your scapula bone. Okay. Before starting the class, I want to tell you something, guys. First, listen properly. Okay. If you have any doubt, you can ask me after the class. Don't interrupt in between the class. Okay. And first, listen properly, then understood. After that, you can write it down in your copy. First, listen properly. Okay. This is your which bone? Scapula bone. Okay. So, first of all, where it is located? Okay. First, you have to know the location. Means where this bone is located. Here you can see this is your scapula bone. Okay. So, this is mainly your which region this is? Thorax, or this is called your thoracic cage. Okay. So, this is your anterior part and this is your posterior part. So, this bone is mainly located your posterior part, posterior lateral aspect of the thorax. Okay. So this is flat. See, this is the flat bone, triangular shaped bone. Okay. This is also called the shoulder blade. Okay. And this is mainly located your posterior lateral aspect of the thorax. Okay. In between your second and seventh rib. This is your rib. Okay. In between the 7th and the 7th rib, your the scapula bone is located. Okay. So first you have to know the location. कहाँ पर है mainly? Where this is located? Posterior lateral aspect of the thoracic cage in between the 2nd to 7th rib. And this is the triangular shaped flat bone, also called the shoulder blade. Okay. First, the anatomical position. Okay. Before starting the anatomical position, you have to know some points regarding your this bone. Okay, means some parts. Okay, always remember this bone having 4 parts. 4 parts. One is your body and another 3 is your processes. There are 3 processes. Okay, there are 3 processes and one except these 3 processes, whole this part is called your body of the scapula bone. So first is body, then the 3 processes. Okay. So this is the first process. This is called your spinous process. See, spine like structure. Okay, spine like projection. So this is the spine of the scapula bone. Okay. So there are the 3 processes. First one is your spine of the scapula. Okay. The spine of the scapula bone continuation to your this process. This process name is Acromion process. Because why this process is important? Because this process is articulate to your which bone? Clavicle bone, and from acromio-clavicular joint. Okay. So this is your which process? Spinous process. Spinous process is continuation to your acromion process. So this is the one process. This is called your spinous process, acromion process. Here another process is present. This is called your Coracoid process. Okay, this process is very much important. Here important muscles are attached here. Okay, so this is your coracoid process. So 3 process, except these 3 process, whole the bone is together called your body of the scapula. Okay, so always remember in the body of the scapula there are 3 border, 2 surface. Do you know what is your body, or it means what is your surface and border? See, this is your anatomical position. Okay, see properly. This is your mainly the surface or border. Border. This is your border. This is your basically which border then? Lateral border. And this is your medial border. So this part called your surface. This is your anterior surface, also called the ventral surface. Okay, and this is your posterior surface or dorsal surface. Okay. Like this only, here also there are 3 border, 2 surfaces. Okay, and here one important structure is present. See, one cavity like structure is present. Okay, this is called your glenoid cavity or glenoid fossa. Okay, see, this is the glenoid cavity. Okay, this glenoid cavity is articulated to your this bone called your humerus bone. Okay, head of the humerus. Head of the humerus articulates with this glenoid cavity, and from your important joint, this is your shoulder joint. Okay, So this part is called your glenoid cavity. Okay. So this is your glenoid cavity. There are three processes. One is called your spinous process. This is called your acromion process. This is called your coracoid process. Okay. Here, always remember in the anatomical position. Now the anatomical position, there are 3 points mainly. Okay. 3 points. First one is your very important point, this glenoid cavity. Okay. This glenoid cavity is always located laterally. Always remember, this is your glenoid cavity. In the anatomical position, you can hold it like this. This glenoid cavity always located laterally. Okay. So this is the lateral side here. If I hold like this is the wrong, because this is your my medial, because this is your midline and this is your medial side. So always remember in the anatomical position, first point is your the glenoid cavity is present laterally. Okay. First point, understood? Glenoid cavity is present laterally. Okay. Another point is, this is called your spinous process or spine of the scapula bone. Okay. Always remember, the spine of the scapula bone is always located posteriorly. Okay. Always located posteriorly. So see, this is your anatomical position, because the 2 criteria is all fulfilled. First one is your glenoid cavity. Glenoid cavity is present laterally. Another is your spinous process. Spinous process is present posteriorly. Okay. And another thing is this process. This process called your coracoid process. Okay. This coracoid process is always present forward, anteriorly. Okay. So if I hold like this is right or wrong? Because the spine of the scapula is not present anteriorly. Okay. Yes, first criteria is fulfilled, that the glenoid cavity is present laterally, but the second criteria, the spinous process is not present here posteriorly. So always remember, spinous process is present posteriorly and the glenoid cavity laterally, and this coracoid process is always forward or anteriorly, like this. So this is the anatomical position. If examiner asks, hold it in anatomical position, first hold it like this. First see that first the lateral, this is the lateral end or the glenoid cavity is laterally present, and the spinous process is posteriorly present. Another is the coracoid process is anteriorly present. Okay. So these are the 3 points regarding your anatomical position. Now the parts. Okay. In the parts, except these 3 process, whole the scapula bone is called your body of the scapula bone. Okay. So the body of the scapula bone having 3 borders, 2 surface. Okay. And 3 angles. Okay. So 3 border, 3 angle and 2 surface. See. First hold it like anatomical position. Okay. Then discuss. First one is your the lateral border. Okay. Always remember, this is your lateral end, means the glenoid cavity is present laterally. So this border is called your lateral border, because here this is your lateral na. So this is the lateral border here. Okay. So this is your lateral border. Another is your, see, this is medially present. So this is your medial border. So lateral border, medial border. Another border is, see properly, नीचे की तरफ तो कुछ नहीं है, ऊपर में क्या है, there are another border is present. This is your superior border. Superior में है ना, superior border. So there are the 3 borders, superior border, lateral end में lateral border, another is your medial border. Okay. Now see properly here, this lateral border and medial border together form one angle. Okay. So this is called your which angle then? Inferior angle, because this is present inferiorly na, that's why this is called your inferior angle. Okay. Now here you can see easily, here another angle is present. This is formed by your lateral border, no, superior border along with your medial border. Another angle is formed. This is called your superior angle. Superior angle, inferior angle. Another angle is present. This is present here only. This is called your lateral angle. Okay. Superior, inferior, lateral side में है. That's why this is the lateral angle. Okay. So there are 3 angle and three borders. Now easily see, there are the two surface. Okay, first one is your anterior surface or ventral surface. Okay, another one is your, this one is your dorsal surface or posterior surface. Okay, this surface is also called your costal surface. Okay, because here your this costal cartilage, main your rib cage are located here. That's why this surface, this anterior surface also called your costal surface. So costal surface, anterior surface, ventral surface. Okay, this is your ventral surface mainly. Okay, or anterior surface. This is your posterior surface. Okay, so three border, three angle, two surface. Clear? Now the processes. Okay, this is your spinous process. Here you can see this is your mainly the posterior surface. The spinous process divided your posterior surface into two parts. See, the spinous process divided your posterior surface into two parts. First one is your upper 1/3, there are the lower 2/3. So this is called your supraspinous fossa. Supraspinous fossa. Supra means ऊपर की तरफ, supra means superior, ऊपर. सुप्रास्पाइनस प्रोसेस के ऊपर में जो है सुप्रास्पाइनस फोसा. ओके, तो बिलो क्या होगा इसका नाम? इंफ्रास्पाइनस फोसा. So this is the spinous process. So the spinous process divided the posterior surface into two ways, upper 1/3 and lower 2/3. Upper 1/3 call your supraspinous fossa and lower 1/3 is called your infraspinous fossa. Okay, clear? And this is your anterior surface. Okay, anterior surface, see properly here, like concave like structure. Okay, concave. Okay, anterior surface. Okay, this is called your subscapular fossa. Okay, subscapular fossa. So this is the subscapular fossa. This is called your supraspinous fossa. Spine के ऊपर में supraspinous fossa. Okay, this is called your infraspinous fossa. This is called your subscapular fossa. Okay, and another one is your, this is your spinous process, continuation to your acromion process. Okay, this is your coracoid process. Now the most important things are the muscle attachment. Okay, first before starting the muscle attachment, now recap all those things. Okay, first this is your scapula bone. Where it is located? Mainly the thoracic cage, posterior lateral aspect of your thorax, in between your second and seventh rib. Okay, and this is also called your shoulder blade. Okay, this is the large flattened and triangular shaped bone. See, next the parts. Okay, the parts is divided mainly body and the three processes. Okay, now see the parts. Okay, this is your mainly like this anterior surface. Okay, the picture is like this, means your anterior surface. Okay, here you can see easily in the anterior surface what structure is present. First one is your, this is called your body now. So this is your, yes, upper border or superior border. Okay, this is your superior border, this is your medial border, because your glenoid cavity is laterally present. That's why this is your lateral border. So lateral border, superior border, medial border. Clear? There are three processes. This one is your coracoid process. This one is your acromion process. Okay, and this one called your spine of the scapula or spinous process. Okay, next this is called your glenoid cavity. Okay, here you can only remember these things. So this is your mainly the ventral surface or anterior surface. Okay, next like this, the posterior one. Okay, this is called your spine of the scapula bone. Okay, this is the continuation to your acromion process. Okay, so the spine of the scapula bone divided the posterior surface into two ways. First one is your upper 1/3 is called your supraspinous fossa, and below the spine process is called infraspinous process. Okay, and These things so you already know. Okay. And angle, see, this is called your superior angle. Here, this is your superior angle, and this is your inferior angle. Another angle is present. This is your lateral angle. Here this is located. Okay, because this lateral angles get covered by this glenoid cavity. Okay, that's why you can't see here. Okay, in the body there are 2 surface, 3 border, and 3 angles. Okay, 3 border means superior, lateral, and medial. 3 angle you easily remember: superior angle, inferior angle, and another is in the glenoid cavity. This gets covered. Here lateral angle is present. Okay. Next, the process, 3 process: spinous process, continuation to your acromion process. Another one is your coracoid process. 3 process. Okay. Now the anatomical position. Anatomical position is very much important. If you forget the anatomical position, you can't pass. Okay. So you should know the anatomical position properly. Okay. First one is your recap all those things. First point, the glenoid cavity. Okay. The glenoid cavity is present laterally. Okay. The glenoid cavity is present laterally. Then next, the spinous process is present posteriorly. Okay. Another one is your coracoid process. This is on anteriorly. Okay. So these are the 3 points. First one is your glenoid cavity present laterally, forward or upward. Just you easily remember glenoid cavity is present laterally. Okay. And your coracoid process, this process is present forwardly. Okay. And another is your spinous process is present posteriorly. Okay. So remember these 3 points. Okay. These 3 points is very much important. Next, the muscle attachment. Okay. One by one, see. Easily remember. Okay. First one is your big muscle. Here, this part is called your anterior surface, but here this is called your subscapular fossa. Okay. Here mainly your subscapular fossa, then subscapularis muscles is attached here. Okay. Here, this part is mainly your anterior surface. Okay. Here your subscapular fossa is present. Here your subscapularis muscles is attached. Okay. Next one is your very much important muscle, serratus anterior muscle. Okay. Because clinically you have to know this muscle very well. So here this is present like this only. Okay. This part means the anterior surface. So in the anterior surface there are 2 muscles are present. One big muscle is present in the subscapular fossa. This is called subscapularis. Another one is anterior muscle. Which what anterior? Serratus anterior muscle. Anterior mein. So here. Okay. So there are 2 muscles are present in here. Okay. Another is your posteriorly. Posterior surface mein there are 2 muscles are present. This is called your which fossa? Upper part of the spine, supraspinous fossa. So here supraspinatus muscles is attached here. Okay. And here infraspinatus muscles is attached. Supraspinatus muscle, infraspinatus muscle. Okay. Clear? Okay. One by one I will tell everything. Now focus the posterior surface. Here lots of muscles are attached. Okay. Just focus. First one is your this part anterior surface mein 2 muscles attached. One is your subscapularis muscle, another is serratus anterior muscle. In the posterior mein 2 muscle. One is your supraspinatus muscle, another is your infraspinatus muscle. Now always remember this is which border? Glenoid cavity present. So this is your which border? Lateral border. Okay. So in the lateral border, remember like this, in the lateral border of the which surface? Posterior surface or dorsal surface, there are mainly 3 muscles are attached. This is called your teres minor muscle, teres major muscle, and little bit about the latissimus dorsi muscle. Okay. This thing I discussed in your dissection class. Just now only remember the name only. Okay. How you remember? Easily. So first this is your lateral border. Okay. Lateral border, posterior surface. There are 3 muscles are attached. First one is your upper 2/3 teres minor, then lower 1/3 teres major. Another one is your latissimus dorsi. Similarly, this is your which border? Medial border. So in the medial border posterior surface there are two muscle mainly. Teres minor ऊपर में था. Similarly here the rhomboides minor ऊपर में ही है. Minor ऊपर में ही है. Okay, rhomboides minor little bit. Okay, here little bit means upper 1/3 and lower 2/3. Okay, rhomboides minor and major are attached here. Okay, mainly the posterior surface, medial border. Okay, so again tell this is your lateral border. Lateral border में in the posterior surface there are three muscles. Okay, teres minor, upper 2/3, then lower 1/3 is teres major. Next one is your latissimus dorsi. Another one is your rhomboides muscle, rhomboides minor and rhomboides major. Okay, here you can see another two muscles are attached here and here. This is your, always remember this is the root, because from here your the spine of the scapula is started now. So this is your root. Okay, so close to your root here levator scapulae muscles are attached here. Okay, and supraspinatus to you already know, here the supraspinatus muscles is attached here. Okay, so clear the muscle attachment. Now easily you remember in the anterior surface there are two muscles. One is anteriorly present. Which anterior? Serratus anterior. This muscle is very much important. Another is, this is called your subscapular fossa. So subscapularis muscle. Now the posterior part. In the posterior part there are so many muscles. First one is, this is your supraspinatus, this is your infraspinatus, and in the lateral border of the posterior surface there are three muscles, and in the medial part there are two muscles are attached. Okay, and in the root of this spine there another muscles is attached. This is called levator scapulae. Okay, now in the process also you can see there are two muscles are attached here. Okay, first one is your trapezius muscle. This muscle is present in here only, upper lip of the spine of the scapula, means this is present upper part. This is called your lower part, means upper lip, lower lip, upper lip, lower lip. Okay, upper lip of the spine of the scapula there are trapezius muscle. Do you know this one is your trapezius muscle? Okay, which can help you shrugging of the shoulder. Okay, so this is the trapezius muscle. Another one is your deltoid muscle. Deltoid muscle is present in your, attached in your lower lip of the spine of the scapula bone. Okay, deltoid muscle is present here. Your intermuscular injection are given this muscle. Okay, this is your deltoid muscle. So understood, in the spine of the scapula there are two muscles attachment. Okay, next is your another important things are present here. This is your which process? Coracoid process. In the coracoid process there are, see there are two surface are present, upper surface, lower surface. Okay, and one tip, see one tip is present here. Okay, in the tip of the coracoid process, these things are very much important, exam में जरूर पूछेगा. In the tip of the coracoid process, the muscle attachment. Okay, so what are the two muscles? One is your coracobrachialis, another one is your short head of the biceps. These two muscles are present your anterior compartment of the arm. Okay, coracobrachialis and short head of the biceps muscles are attached in the tip of the coracoid process. So in the tip of the coracoid process two muscles are attached here. One is your coracobrachialis, another one is your short head of the biceps muscle. Okay, then next is your acromion process. Another muscle is, see in the acromion process also, see the deltoid muscle is covered the acromion process also. Okay, so in the acromion process in the lower part, means this is called your lateral border, means laterally present. Okay, in the lateral border of your acromion process the deltoid muscles is attached. Okay, see, means this deltoid muscle is continuation to your this acromion process also. Okay, so the deltoid muscles is present here only. Okay, now next last one is your this part called your glenoid cavity. Okay, here this is mainly the surroundings of the glenoid cavity, it is called your glenoid labrum. Here this is mainly the fibrocartilaginous, because here your head of the humerus bone is attached here and from your shoulder joint. Always remember, the shoulder joint is very important question, 10-mark question, okay, in the theoretical point of view. Okay, so this is your glenoid cavity. Surrounding to your glenoid cavity, this is called your glenoid labrum, and this is mainly the fibrocartilaginous, because here your head of the humerus is attached here. Okay, another 2 point last, the muscle attachment is, if this is your glenoid cavity, upper part of the glenoid cavity is called your, one tubercle is present here, lower also one tubercle. Upper part means this is called your supraglenoid tubercle, means glenoid cavity के ऊपर में है supraglenoid tubercle. Okay, see here, this is your supraglenoid tubercle, infraglenoid tubercle. Okay, in the supraglenoid tubercle, the biceps muscle, long head of the biceps muscles are attached here. Here the short head of the biceps muscle attached, but here the long head of the biceps muscles are attached here. This is called your supraglenoid tubercle. Glenoid cavity के ऊपर में जो tubercle है, this is called your supraglenoid tubercle. This is your infraglenoid tubercle. So in the infraglenoid tubercle, there are triceps muscles are attached here. So here biceps, here triceps. Okay, so that's all about the muscle attachment. Okay, and the different parts. These things I discussed already, but here you can see there are, see properly, there are two notches are present here. One is this, another is this. Okay, this two structure is very much important. Okay, this two structure. Okay, see. One is called your spinoglenoid notch. Okay, question में answer है spinoglenoid notch. This is called your spine of the scapula. So this is your glenoid cavity. In between the spinous process and glenoid cavity, there are one notch is present. Okay, this is called your spinoglenoid notch. The spinoglenoid notch are connected in between your supraspinatus fossa and infraspinatus fossa. The important artery and nerve are passes through this. This is called your suprascapular nerve, and vessel passes through this notch. Okay, this is called your which notch? Spinoglenoid notch. Why this notch is important? Because here your suprascapular nerve and vessels are passes through it, and connection in between your supraspinatus fossa, in supraspinatus muscle to your infraspinatus muscle. So this is called your spinoglenoid notch. Another one is your this part. This is called your suprascapular notch. Suprascapular. This is called your spinoglenoid notch. This is called your suprascapular के ऊपर में, superior में. So suprascapular notch. Here your suprascapular artery and nerve are passes through this. Okay. Here one you can't see here, but here one ligament is present. Okay. By this ligament, okay. If one ligament is present, na, see one foramen is present na here. If one ligament is present, okay, so one foramen is formed na here. This line is, see properly, the suprascapular notch is converted into the suprascapular foramen by the superior transverse ligament. One superior transverse ligament suppose here present, by which your this part is form one foramen. Okay, this is called your which foramen? Suprascapular foramen. From this foramen, your suprascapular artery and nerve are processed through this. Okay, so these things also important. Examiner may ask these two part. One is your spinoglenoid notch, another is your suprascapular notch. Okay, so that's all about the scapula bone. Okay, you have to remember these things. Okay, so this is mainly the location. Okay, next the parts, body and process. You all know the body and the spinous process, acromion process and coracoid process. Three process finish. Next in the body there are two surface 3 borders, 3 angles. Okay. Next one process you all know, the spinous process, acromion process and coracoid process. Next anatomical position, very much important. In the practical copy also you have to write. First in the practical copy, first you have to write the details, means the some features regarding your scapula bones, where it is located. Okay. The next you have to write the anatomical position and side determination. So by knowing the anatomical position, you also determine the side also. Okay. Suppose this is your left side scapula. How I am telling this is your left side scapula? You remember the points. First one is your, this part is called glenoid cavity, is located laterally. Okay. Spinous process is posteriorly and the coracoid process anteriorly. So this is your then left sided scapula bone and this is your right sided scapula bone. Okay. So by knowing these 3 points, you can easily tell, you can easily differentiating points how your right side and left side are divided. Okay. Now write these 3 points. Next one is your features along with the muscle attachment. Okay. Suppose first the surfaces, in the costal surface you all know, in the costal surface this is called your subscapular fossa or anterior surface. Here you just write the, this is here your subscapular fossa is present, here your subscapular muscles is, subscapularis muscles is attached here. Okay, finish. And also here one anterior, serratus anterior muscles is attached here. There are 2 muscles attachment. Okay, in the anterior or ventral surface or costal surface. Just write simply this point. No need to remember these things. Actually there are 3 ridges are present. Okay, 3 ridges are present. The muscles is attached like this. This is the main reason. It's present 3 longitudinal ridges. See, okay, which provide the attachment to the intermuscular tendon of the subscapular muscle. Means easily you remember in the subscapular fossa, subscapular muscles is attached. Okay. Next the dorsal surface. You all know. Easily you have to write in the dorsal surface by the spine of the scapula, your supraspinatus and infraspinatus fossa is present, and here your supraspinatus muscle attached here, here your infraspinatus muscles is attached here. Okay. And here this point is mainly regarding your spinoglenoid notch. Okay, here one notch is present, the spinoglenoid notch. The spinoglenoid notch lies in between the lateral border of the spine and the glenoid cavity. Okay. So through this notch, this supraspinatus fossa is communicate to your interspinatus fossa. Okay. And here you mainly which artery and nerve passes? Suprascapular artery and nerve passes through this. Okay. This is the meaning of this line. The spinoglenoid notch lies in between the lateral border of the spinous process. Through this notch, your suprascapular fossa is communicate with your infraspinatus fossa, and the suprascapular nerve and vessel passes from this region. Okay. Suprascapular to infrascapular. Supraspinatus muscle, you all know, arise from the medial 2/3 of the supraspinous fossa. Here means the supraspinatus muscles is attached to supraspinatus fossa. Similarly, infraspinatus muscle is present in infraspinatus fossa. The teres minor, upper 1/3 of the lateral border of the posterior part. Teres major is lower 1/3. Okay, and the latissimus dorsi is the dorsal surface here, close to your inferior angle. Okay, you just simply remember all those things. Okay, simply. Point wise, first one is your location, then anatomical position, now the parts, then the muscle attachment. If you don't want to write, I am stop it. Okay, then you will teach me everything. Okay, because there are another portion is present. This is called your ossification, then clinical anatomy also. Okay, your class is not finished. Just now I am just telling the different parts along with the muscle attachment. Okay. So okay. Next one is your ossification. Okay. In the ossification, always remember there are ossification means, do you know what is ossification means? How Yes. So always remember, very easy, in case of the scapula bone, there are the total 8 ossification center. One is primary center, is appears in the body. So primary means all the body, okay, it is from. And another one is secondary center. Secondary center is 2 center, this is a coracoid process, and 2 center in the acromion process. And another 3 centers are present. One is your medial border, inferior angle, and glenoid cavity. Glenoid cavity, medial border, and inferior angle. Okay. You just write these things. Okay. Ossification. You finish your parts and all those things. Muscle attachment here. All those things. Simply you just write. Okay. In the borders. In the lateral border also. How the lateral border is formed. You can write. I am again and again telling, don't interrupt in between the class, okay? I am simply teaching all those things, okay? Simply learn, don't interrupt. If you don't want to write, then tell, sir, I don't want to write. I am just telling you, if you write all those things, little bit, you can't forget all those things, no? You just recap and you can remember all those things, no? So the lateral border, this is the lateral border. The lateral border is the thickest border. Okay, see, the medial border is thin as compared to the lateral border. So lateral border is the thickest border, and this border is present in between the, see, this is called your inferior angle. Inferior angle to your glenoid cavity. This is present. Okay. And infraglenoid tubercle, here infraglenoid. This is the infraglenoid tubercle. Here your triceps muscles is attached. Infraglenoid tubercle. This is your supraglenoid tubercle. Here your biceps muscle, long head of the biceps muscle attached here. This is your infraglenoid tubercle. Here your long head of the triceps muscles are attached here. Okay. In the medial border, no need to write all those things. Just write in the root of the spine. There the levator scapulae muscles is attached here. In the upper 1/3, your rhomboids minor muscles is attached here, and the lower 2/3 rhomboids major muscles is attached here. Okay, in the medial border mainly. And here, see this part, this point, the serratus anterior muscles is attached here, here mainly. This is your which surface? Anterior surface, medial border. Anterior surface, medial border, serratus anterior muscle, and the posterior surface, there are 3 muscles attached. Okay, just write simply. Examiner asks only muscle attachment. Okay, just demonstrate. Examiner asks, show me the rhomboids minor muscle where this muscle is attached here. You just show the rhomboids minor muscles attached here, upper 1/3 of your medial border of the posterior surface. Okay. नेक्स्ट द एंगल, इसमें कुछ लिखने की ज़रूरत नहीं है. एंगल, डू यू नो हाउ दिस एंगल इज फॉर्म? सुपीरियर एंगल बाय दिस सुपीरियर बॉर्डर एंड दिस मीडियल बॉर्डर, एंड inferior angle by this 2 border, and this lateral angle is by this and this border. Okay, finish. No need to write these things, just write the muscle attachment. Okay, just write in the spinous process, upper lip, your this muscle, trapezius muscles is attached, and in the lower lip, your deltoid muscles is attached, and in the acromion process, only the deltoid muscle in the lateral border. And another one is your this coracoid process. Okay, right here, the coracoid process, this point. Okay, this point is very much important. In the coracoid process, there are 3 muscles attached. Okay. Here your tip of the coracoid process, here your short head of the biceps and coracobrachialis muscles is attached. Another is the in the upper surface, your the pectoralis minor muscles is attached here. Here pectoralis minor muscle, and here your another 2 muscles. So 3 muscles are attached in the coracoid process. Okay, these questions are come again and again. Coracoid process, the muscle attachment of the coracoid process in the OSP, means the in the practical exam. Next, this ossification. Okay, just write the ossification centers. There are 8 centers. Primary is your body, and another 2 is your coracoid process, another 2 acromion process, and another 3 is medial border, inferior angle, and glenoid cavity. Okay, now the last part of the clinical anatomy. Okay, if you answering all those things, examiner asks regarding the clinical anatomy. Here the most important thing is your this winging of scapula. Winging of scapula comes as a short note also. Okay, 5 marks. Okay, here what happened in the, this is your which part? Anterior surface. Here one muscle is attached. This is called your serratus anterior muscle. Okay, this serratus anterior muscle get paralyzed. How? Because always remember, if any muscles get supplied by any nerve. Okay, suppose in your biceps muscles also there are one nerve supply. This is called musculocutaneous nerve. Similarly here on also the serratus anterior is supplied by the long thoracic nerve. Long thoracic nerve. So this long thoracic nerve get affected by any conditions like your these conditions. The common causes of this nerve damage in trauma like fall or accident, this nerve get injured. If this nerve get injured, so this muscle get paralyzed, because this muscle get supplied by this nerve na, long thoracic nerve. So serratus anterior muscle get paralyzed. Okay, so this serratus anterior muscle mainly present which border? This is your medial border. Medial border. So here your medial border is prominent. Okay, if you resist in your wall, you see here your medial border is prominent. Okay, for whose patient are these things are happen na, winging of scapula, not the normal people you can see. Okay, just the winging of scapula patient you see. Here what? See, first the serratus anterior muscle are present in the medial border of the scapula, closely applied to the scapula. But injury of the long thoracic nerve causes the paralysis of your serratus anterior muscle. Okay, so when the patient asks, आप लोग अगर patient को बोलोगे just for examination, okay, just push against the resistance. Okay, the medial border of the scapula of the affected side is stands out, means prominent, the medial border. Okay, so this situation is called your winging of the scapula. Okay, your scapula is wing. Okay, means the medial border of the scapula is prominent by the serratus anterior muscle paralysis. So the winging scapula is caused by the weakness or paralysis of the muscles of the shoulder vein, most often due to the injury of the long thoracic nerve. Common causes of the this nerve damage is your trauma like falls or car accident. Okay, or repeated activities, overweight activities. Okay, and another important things in the mastectomy surgery. Do you know the mastectomy surgery? Means the breast surgery. Okay, in the breast surgery, if the surgeon get injured this nerve, so your this muscles is paralyzed. Okay, so this condition is called your winging of the scapula. So winging of the scapula comes with a short note. Okay, so you first write what is this winging of scapula, right? And then if you want, you can draw one diagram also. Then the causes, main causes. Okay, if 5 marks question are come, you also write the this treatment part also. Treatment part means physiotherapy. Okay, some analgesic. Okay, and if need, surgery also needed. Okay, next one is the causes of the winging of the scapula. Means the long thoracic nerve is injured. By which conditions? Your long thoracic nerve injury, like any kind of trauma and mastectomy surgeries and repeated overhead activities. This is the normal scapula. Okay, you can't see this prominency. Okay, but in the winging of the scapula, you see the medial part is wing-like structure. So next one is the scaphoid scapula. This is the congenital or development anomaly, because when the fetuses get intrauterine life, these things are happen. Okay, means the medial border is concave here. Okay, here to the medial border is not concave like straight. Okay, but In case of the scaphoid scapula, the medial border is like curve, okay, concave. Next one is your springal deformities. Here your scapula get present in the neck region, okay. So these two are mainly the development anomalies, but these things are very much important. Winging of the scapula comes as a short note, or examiner may ask in the viva, okay. Winging of the scapula, you simply tell the serratus anterior muscles is paralyzed because of the paralysis of the long thoracic nerve, and long thoracic nerve get injured by any condition like injury, mastectomy surgeries, okay. So your medial border is prominent here. So this condition is called your winging of the scapula. So in the winging of the scapula, mainly which nerve get injured? Long thoracic nerve, and the muscle is serratus anterior muscle, okay. So that's all about the today's class, okay.